Like, we want to know that we're not putting too much stress on those arteries, on those veins, or really particularly on the arteries. We don't want to put too much stress on there. Overstressing them for too long can cause them to break. Too much pressure on those capillaries can cause them to break. So we don't want to do that. So we want to make sure that we're keeping that number fairly healthy. Too much pressure over long periods of time can also cause us to kind of tear into those arterial walls, which we really, really don't want. Now, what we were just looking at is a pressure. We can sense pressure with certain types of receptors, namely baroreceptors. Okay, so we're going to have baroreceptors in many of our blood vessels, especially our larger arteries. So we're going to have baroreceptors in places like our brachiocephalic or our cephalic arteries, so up here in our carotids. We're also going to have baroreceptors up here in our cardiovascular center up in our medulla oblongata, right? So that we can measure what these pressures are. We need to know what these pressures are at all times so that we can regulate them. If someone is exercising, it's totally fine for them to have a higher blood pressure. If I walked a few laps, I'd come back in, you'd check it, and it would be 140 over 100. And exercising, that's totally fine. Why? Because we need more perfusion to more tissues. So we expect that pressure to go up, those arterial, so that we can send blood where it's supposed to go. Okay. However, we do want to monitor that so that we can lower it or raise it depending on the needs of the body. So we're constantly measuring it so that we can constantly regulate it. If it gets too high, we do some parasympathetic innervation and dilate some vessels, lower those pressures. If it's too low, that means we sympathetic innervation and start to close vessels off to bring it back up. Okay, so we're constantly going to have this battle, like we're trying to maintain it roughly this 120 over 80 most of the time. Oh, I'm probably, oh, no, y'all can hear me. So we are going to call it, like, those are just reflexes doing that. Now, one of the other ways that we can regulate it over a longer period of time is going to be through hormones. Okay, we're going to regulate it through what we call the renin-angiotensin system. Okay, where we're going to, angiotensin. Okay, so angio meaning vessels, tensin meaning pressure, right? It's basically how much pressure are there in the vessels. Okay, renin, as its name implies, is going to come from the kidneys. Okay, why do you think the kidneys would be a great place to measure blood pressure? What are our kidneys regulating? Input, output of what? Urine, but what's in urine? Not blood, I hope not. Not bad, better not be bacteria or blood. Both of those are bad. If those are in your urine, you have a problem. You have been to a house of ill repute if both of those things are occurring. Water. Okay, yes, we have urine in there. Urine contains waste products like metabolic waste, so urea, things like that, but it's also where we control water. If we want to raise blood pressure while having the same number of red blood cells, we just add water. This is a closed system. Add more water, all of a sudden there's more pressure against those vessels, right? So that's going to raise our blood pressure. Well, what regulates water levels? Your kidneys. Perfect. So now we have a place that not only can measure water levels, but can also regulate water levels. That seems like the perfect place for also monitoring and regulating blood pressure. If we want to raise our blood pressure, we just simply hold on to more water. If we want to lower our blood pressure, we get rid of some excess water. Okay, because that's going to be one way that we can do this. So our kidneys are going to release renin in response to low blood pressure. Okay, so renin, so we notice that blood pressure is low. Oh, potassium. Yep, potassium is also going to play a big role here. Okay, so we are going to be looking at potassium as one of those nutrients that's being looked at here, and also potassium can inadvertently raise blood pressures too. Okay. So yes, that is one of the things that's being regulated. All right, now, in response to low blood pressure, our kidneys are going to release renin. This basically says, hey, we want to hold on to some more water. Okay, by holding on to more water, we can raise our blood pressure because we're raising our blood volume. More blood volume means more blood pressure. Okay, now this is going to happen through a set of conversions. So just like if we released, thyrotropic releasing hormone from our hypothalamus, that caused the release of thyrotropic hormone from our hypothalamus, right? or sorry, not from the hypothalamus, but from the anterior pituitary, okay? Where we're gonna see this cascade. We're gonna see the same type of cascade of reactions here. When we release renin, renin is going to cause angiotensinogen, which is just a protein that's found in the blood at all times. It's going to cause it to convert. So remember, ogen means to make. So angiotensinogen means it's going to make angiotensin, okay? So it's going to get turned into angiotensin 1. Angiotensin 1, when that happens, it will get basically immediately converted into angiotensin 2 by this enzyme called ACE. Okay, so called angiotensin converting enzyme, or ACE. This enzyme, angiotensin 2, is going to, and this one is going to be found in the lungs. Okay, this is going to cause us to raise our blood pressure. Why? Because it's going to be a vasoconstrictor. If you increase the amount of angiotensin 2 in someone's blood, it basically is going to cause the blood vessels to constrict. When this happens, it basically raises the amount of resistance. More resistance means more blood pressure. Okay. It also tells us to drink more water. Well, if you want to increase water volume, a great way to do that is just drink more water. Okay. Drink more water raises our blood volume, raising our blood pressure, right? So vasoconstrictor raises blood pressure. Simulates thirst, makes you drink more water, which raises blood volume, which raises blood pressure. It also tells your kidneys to decrease urine formation, which means you're getting rid of less water, which raises your blood pressure. We're raising your blood pressure in 1, 2, 3, and 4. Angiotensin 2 raises blood pressure in 4 distinct ways. Vasoconstrictor tells us to drink more water. More water means more blood volume, which means higher blood pressure. Tells the kidneys to get rid of less water. So you're drinking more and peeing less, raises your blood pressure. And then finally, it is telling us to stimulate the release of antidiuretic hormone, which also tells us to decrease urine formation. So we're raising our blood pressure in 4 distinct ways. Does that make sense? All from angiotensin 2, which means if you want to, say, lower someone's heart pressure or blood pressure because they are walking around with a resting blood pressure that is too high, maybe one of the reasons that they're walking around with the blood pressure that is too high is because they have an overactive ACE enzyme. So you give them drugs that lower their ability of their angiotensin converting enzymes to make angiotensin 2. No angiotensin 2, which means we don't have stimulated thirst centers. We aren't decreasing urine output. We're not stimulating as much release of antidiuretic hormone or aldosterone. Okay. We keep that number down. Many long-term blood pressure control medications are ACE inhibitors. So if you've ever been watching TV and you've seen a commercial for a blood pressure thing and they call it an ACE inhibitor, or do not take with other ACE inhibitors, that means that it is an ACE inhibitor. That's what it is doing. It is trying to stop this particular pathway because the renin-angiotensin system is there to raise blood pressure. But if your blood pressure is chronically too high, one of the ways that we can lower it is by inhibiting this system, by basically trying to turn this off, because maybe your blood pressure is too high because you have an overactive version of this enzyme, or maybe you have an overactive version of this pathway. So this is actually how many different drugs work, is they find one of these chemical reaction pathways and they stop one of the steps in that chemical reaction pathway so that we can stop the downstream effects of it. Okay. My blood pressure medication is an ACE inhibitor. It inhibits this pathway. Now, another fun thing is, you may have also heard a couple years ago about this ACE enzyme. That's because this is one of the things that COVID messed with these enzymes. One of the reasons COVID was dangerous, particularly for people with high blood pressure, is because it made this worse. It basically acted as an ACE uptick. So it made their ACE enzymes even more active, which means someone that had a chronic blood pressure of 150 over 110 now would start spiking, or not even spiking, just would have a constant blood pressure of 175 over 130 all of a sudden. Like starting to make it really easy for you to push into danger zones, which means when that person gets stressed, it's real easy for them to just tick up over 200, which means you can potentially start to have issues like downstream issues, kidney issues, and stuff like that because of having too high of a blood pressure. So that's one of the reasons why COVID was so dangerous for people that had high blood pressure, is because it basically took this system and ratcheted it up a degree. Does that make sense? So this renin-angiotensin system, remember, starts in the kidneys where we are sensing blood pressure. Blood pressure is too low. We release renin. Renin takes angiotensin, which is just in the blood all the time, made by the liver, but in the blood all the time, and converts it into angiotensin 1. Angiotensin 1 gets converted by the ACE enzyme in the lungs. Oh, wait a minute. COVID was most active in people's lungs. I'll be damned. Almost like it kind of works out that way, right? Now you're starting to see how some of this stuff adds all together. So not only does it affecting the lungs and it makes these ACE enzymes worse and makes them too active, it's also most common in the places where this occurs. Fun, okay? It also causes you to cough, which means you're expelling more of the virus from your lungs. Almost like that's exactly what this virus was trying to do, because it makes more virus in the lungs and then gets spit out onto more people that they breathe into their lungs, so it can do the same thing over and over and over again. Okay, we're going to talk a lot about COVID next time, just because COVID's fun. All right. Also, it's still part of the cultural zeitgeist. Y'all actually remember more about it than you think you do. So that means it's a really good teaching story or teaching moment. All right, so ACE converts angiotensin 1 into angiotensin 2. Angiotensin 2 increases blood pressure by causing vasoconstriction, stimulating the thirst center, and then decreasing urine formation. Everybody good? Great figure. Learn this figure. Learn this figure. You will see this figure again, I promise. Cool. All right, there we go. So that is blood pressure regulation in a nutshell. At least one of the ways that we can regulate it. We regulate it in many other ways, but this is just one of the ways that we can do that. We can also do it, once again, by regulating fluid levels. One way to do that is antidiuretic hormone. Tells you what it does. Makes you not diurese, which means you don't get rid of urine, or you don't make as much urine. Holding on to water increases blood pressure. Atrial natriuretic peptide. This one is kind of the opposite. This one basically tells you to release additional water. So it basically stimulates vasodilation. It also increases urine output. So this is a way to lower blood volume and thus lower blood pressure. So this atrial natriuretic peptide is kind of your opposite, kind of sort of your angiotensin 2. Everybody good? All right. So that's it. If you're worried about, if you want to know what hypertension is, this is basically what I have. As well as basically every other, especially common in males. It's especially common in European males. It's also especially common in people that are big. It's also especially common in people that are overweight. All of these things can lead to hypertension and thus arteriosclerosis, which means I will die of a heart attack in like 10 years. It'll be fine. Now, at least if it did not get regulated, which it is now. If you wanted to see how blood pressures are going to change and kind of blood volumes and stuff like that under different exercises, here's a great figure for that, so we can see kind of where blood gets shunted under different activities. When you start to need more blood going to your systems, or particularly your muscles and stuff like that, we're going to shut down how much is going to make you pee. If you've ever noticed, like if you've ever been on a jog, or especially like strenuous exercise, you don't really need to go to the bathroom while you're doing that. It's very uncommon for you to need to like take a break to go to the bathroom. Why? It's because very little blood actually starts getting sent to your kidneys. Very little blood starts getting sent to all of your abdominal pelvic organs. Basically just enough to maintain them, not enough for them to do their jobs really. So that we can actually send way more blood out to your muscles to help them work. Look at this number here. Skeletal muscles, 1,100 milliliters per minute at rest. Skeletal muscles in strenuous exercise, 12,500. We just multiplied by over a factor of 10. That is how much more blood gets sent to your muscles during exercise. Same thing goes for your brain and your heart. Your heart went up by 3 times. Your skin went up by 5. Why did your skin go up by 5 times during strenuous exercise? Perfect. We're using it to regulate temperature. We're letting our skin act as a heat sink. Okay, so we're letting the outside environment act as a heat sink. So we're routing some blood to the skin so that we can sweat off some of that extra heat that we're generating with all the muscles doing all of their fun stuff. We'll talk about pulmonary circulation a lot next time. Basically, just know that our pressures here are way low. We have way less elastic connective tissue. We have wider lumens, lower blood pressures. Why? Well, that's because we want things nice and slow so that we can get as much oxygen in as we possibly can. We also don't need as much pressure because your lungs are like 6 whole inches away from your heart. That is not the case for your little toes that are 3 feet away, right? And have to go through a bunch of stuff in between. So our pressures are a lot lower here for a couple of reasons, namely for distance and then for, not for fusion, but for slowing the blood down so that you can get additional blood into, or additional oxygen into the water, or into the blood. Make sense? All right, any questions on this stuff? All right, then we're good to go. No, you're fine.